from the station that's on your side. This is Channel 7 News Daybreak.
Are you ready for some football? Because we are. High school football starting up. It's that time of the year. College will start in a week and a half, and it will be one of those seasons where it will not be injury-free for everybody. It's just a matter of fact. Joining us this morning to talk about ways to help make football season as safe as possible is Baptist Health's Dr. John Allen Cockerell with Sherwood Family Medical Center. And great to see 2 weeks in a row you get to wake up with us early here on Daybreak. Football season is, I think, something a lot of people look forward to this time of year.
Much fun.
There's no question. There's a lot of excitement in the air about it. But with that, we've already seen injuries with fall camp already taking place for a couple of weeks. What are the most common injuries that you guys see and that doctors see this time of year with football players?
Right. So, man, I love football. I'm so happy it's back, yes. But it's injury prone. It's a contact sport. So musculoskeletal injuries, I think we're going to get into in just a second. Concussions are big. I wanted to kind of touch on that as well. But also just the conditions that we're playing in right now. So it is hot, if you haven't noticed.
Right.
And so
heat advisors.
I think there's hopefully going to be some relief coming. But, if you think it's hot, put a helmet and pads on and go outside, right? So things like heat exhaustion, possibly even heat stroke, the more severe of that. So if you're hot, you're tired, that's one thing. But if you're having really bad symptoms of concern, tremors, shakes, nausea, vomiting, headaches, get that looked at as well. So,
concussions, you mentioned that, and that's something that's been, I think, highlighted around the country in recent years. There's a movie about it starring Will Smith at one point. So and the NFL has taken a lot of steps to try and get the youth to be more educated and more aware of the signs of concussions. What are those signs that parents and trainers need to be on the lookout for that are going to happen, unfortunately, during the season?
Right, it is unfortunate, and there can be a cumulative effect over time of concussions, but the thing to note is that it's a temporary loss of brain function, so it's temporary, right? You're going to have confusion acutely, right, to start with.
So these are noticeable signs.
These are noticeable
off the
signs,
top.
right?
Yeah, okay.
Some of the things that happen after a concussion may not be quite as evident, so prolonged sleepiness, extreme fatigue, irritability, or mood change, lack of focus, those things, parents probably need to watch for, in their children.
Okay, and then finally musculoskeletal, you mentioned that off the top, just how it's a myriad of options to choose from, but what's the most common thing you see? Is it knees? Is it ankles? Anything above the waist? What are we talking about here?
Sure, so I think the major areas, most common is kind of hard to say, but most common you're dealing with the shoulder on the upper extremity, right? So dislocations, fractures, things like that. And then the lower extremity, anything's fair game. So hip, knee, a lot of knees and ankles. If you can't, bear weight, or if you have limited range of motion, don't play through that. Get that checked out.
One thing if it's a bruise, it's another thing if it's a tear or something worse. So
absolutely.
Don't want to make it even worse. Now, if you do get any injuries during the football season and you'd like to get those taken a look at, you can always contact Baptist Health. Of course, by calling Baptist Health's Health Line, 1-888-BAPTIST. You can also go to baptist-health.com for more resources. Great to see you.
Absolutely.
1 week away.
Thank you.
Even sooner for some folks out there playing football.